Okay, so today we have Jack here. He is a 42-year-old male. He is experiencing some left neck, parascapular, and arm pain. And he's also experienced paresthesia distal to his left elbow that's extending down into his first and second digits. There was no specific trauma to cause these symptoms, but he was doing yard work about a week ago, which caused the onset of these symptoms. He says that he's at about an 8 out of 10 pain right now. And based on his range of motion and some reflex and strength testing, it appears that he has a C5, C6 disc herniation. So today we'll be doing some cervical traction to try and relieve some of those symptoms and his pain. Some indications for cervical traction are disc herniations, nerve root impingements, joint hypermobility, subacute pain of the cervical region, and peripheralization of symptoms. Some contraindications to performing cervical traction are acute strains, sprains, and inflammation. And since this happened more than 5 days ago, we're good and he's out of the acute phase. Also, if his symptoms peripheralize during the treatment, that's an indication to stop. And if the patient has any prior surgical stabilization or decompression of the spine, as well as spinal implants and prosthetic discs in his spine, then we won't perform this procedure. All right, hi Jack. My name is Amber. I'm a student physical therapist from Rocky Mountain University of Health Professions, working under the direction of Dr. Clausen. How you doing today?
Good, it hurts.
Yeah, that's what I've heard. So what I was thinking that we do to help relieve some of that pain that you have in your neck and also those symptoms that are radiating down your arm is cervical traction. So basically, I'll put your head here and we'll get you strapped in, and then I'll turn on the machine and it will kind of just pull on your head a bit, and it'll cause more space in between your spinal bones and like the discs that are in between those bones, to hopefully relieve some of that pain and decrease those symptoms that are going down your arm.
Okay.
Does that sound okay with you?
Yep, that sounds good.
All right, cool. So I just have a few questions before we begin. Have you had any prior surgeries to your spine before?
No.
No? Okay. Then we're good to go. So if I could have you please lay down here, and we'll put your neck. So you kind of want like this part of your neck right there. Perfect. All right. Is that comfortable for you?
Yeah.
All right, so these things on the side of your neck, they should be like, it should feel firm, like they're holding your head in pretty firmly, but it shouldn't be too tight or too loose.
Okay.
So how does that feel, do you think? Is there
Pretty
wiggle
good.
room or?
A little bit of wiggle room if you want
bit?
to tighten it.
Okay. Wrong way. Okay, you let me know.
There you go, yeah.
Right there?
Yeah.
Okay, awesome. And I'm just gonna put this over your forehead like so.
Okay.
Just to make it more comfortable, because I do need to put a strap across your forehead. So that's okay with you?
Yeah.
All right, sweet. And I'm just gonna assess, oh yeah, good call. I'm just gonna assess the forehead skin area. It's looking good. And we'll go ahead and place this over. Bring the strap on over. All right. Oh. All right, so this I want to be also pretty firm, but not too tight, not too loose.
Okay.
Kind of that same concept that we did down below. So you let me know. How's that?
Good.
Good? Okay, get you strapped in. Feels pretty good to me. All right, and here are a couple pillows for underneath your knees in case you want these just to be a little more comfortable. How's that?
Good.
All right, all right. And we'll come on over to our machine here. So we're doing the cervical region. I'm just gonna push manual. Oh yeah. But first, let's do this before I get this thing set up. All right, Jack, so this right here is an emergency stop switch. And whenever I start the machine, if it hurts at all or if you feel symptoms, like that radiating down your arm pain, I want you to push this button. Like it shouldn't be painful at all. It should actually feel good. So
Okay.
there's that for you. And what we'll do here is we'll set our time to 10 minutes. Manual, yep. Progressive steps 3 is good. And we're going to do a static hold. Done. Awesome. So now that we have that set up, I'll take this here and attach it right there to that. Awesome. All right, and we're at a 23-degree angle, which is perfect. We want to be between 20 and 30. And all right, Jack, I'm gonna start increasing the pull on this here machine.
Okay.
And I'm gonna go to the lowest setting first and see how that feels.
Sounds good.
All right, here we go. You're doing all right?
Mm-hmm.
Alrighty. And there's good. About 20 pounds. That's where we'll begin. You doing all right?
Mm-hmm.
Okay,
Yep.
I'm gonna go ahead and push start. All right, Jack, how's that feeling? Is that relieving some of that pain there?
Yeah, I feel like going it back up to my neck rather than in my elbow.
Oh, I like that. That's great news. So no pain. You actually feel less pain, correct?
Yeah, less pain. There's still some pain, but it's not in the elbow anymore.
Okay.
Yeah.
And I could increase the traction even since he is still feeling some pain. But since this is his first treatment, I'm just gonna go, I don't wanna push it too hard. So I'm gonna go ahead and just push the stop button here. It's been 10 minutes, so we're gonna push the stop button here. All right, Jack, so it's just gonna decrease that pulling pressure that you feel here. And it should be already done. Yep. All right. All right, very good. I can take that switch from you.
Mm-hmm.
All right, and we'll assess the skin one more time. There is a little bit of redness there, but that is normal with this treatment. And all right, we're gonna just kind of hang out here for a few minutes, just because it would be a big change if we sat you up from like your spine being kind of stretched, and then yeah, so we're just gonna hang out.
Okay, sounds good.
So we have minutes. I'm gonna go ahead and grab these pillows from underneath your knees.
Okay.
Thank you. All right, yeah, you can sit on up, Jack. How you feeling?
Good.
Good?
Mm-hmm.
All right, ready to start our session today?
Yep.
All right, amazing.